Welcome to the Gary Null Show, a program designed to enhance mental, physical, and spiritual well-being through science and the wisdom of the ages. Let us take you on a journey of empowerment. Sit back, relax, and get ready to change your life for good.
Well, it's a lot of work, but she's just worth it. It's like a child almost. You wouldn't deny a child anything. And she's such a good friend, and she's such a good companion. I don't know what it would be like to come home to an empty house. It's nice to have the animal to come home to.
Birds offer a different kind of companionship because they speak to me. So Luann, I love you.
These ferrets really make me feel better when I feel stressed out.
There was a cat in the crib when my mother and father brought me home from the hospital. My children had our Blue Point Siamese cat in the crib. They've been a part of my life, all of my life. They've enhanced my life. And I've enhanced their lives.
He's just kind of came into my life, and that's the way it is. I think animals find you, you don't find them.
That's the thing about puppies. I mean, there's not like people. They're not gonna rip you off, steal your boyfriend or girlfriend.
My fish just bring me to another place. It's like a whole other world in that aquarium. The colors and the movement. Just imagining what they must feel relaxes me.
I've always loved horses from a little girl. They're incredibly energetic and forgiving animals. They keep me grounded and in touch with nature.
If you have a pet, you're a lucky person. And if you give all the joy and love that you can to your pet, you're a special person. There's a way that pets help keep us humble and humane, and it touches both the masculine and the feminine within our nature. I don't know if you have a parakeet or a cockatoo or a cockatiel or a dog or a cat or fish or horse, whatever you have. It can be healthier, it can live longer. I'm Gary Null. I'd like to welcome you to a very special presentation on natural pet health. It'll be a fun journey. And the payoff at the end is that you might have a dog with you twice as long, or a cat, as you otherwise would have, without having to pay enormous vet bills. And even the question and controversy around vaccines. Should you automatically vaccine for whatever the vet says? Maybe not. We'll explore that as well. Join me now.
Have you been told that your animal has to be put to sleep because there's no hope, there's nothing more that science, that medicine can do for them? What I want you to know is that there is hope. 80% of the animals that come to me, I can help to lead a healthy and normal life. And if I can do it, other vets can do it also.
If you understand your dog or your cat's personality and integrate its personality into the diet that you feed your pet, the care that you take of it, even the inoculations that you give it, that can have an effect on the quality of its life and its relationship with you.
It's the spiritual connection that we have, why they're in our existence, why we love them so much. It is so real. And when we deal with animals in our practice, we always deal with them on 3 different levels: mind, body, and spirit. And if you just deal at the physical level, you will lose. You will have to lose. Here is a survey by the Morris Animal Foundation in 1998, and it shows that the top of the list of diseases that cats and dogs are getting is cancer. My first 15 years as a veterinarian, it was always skin conditions, gastrointestinal conditions, bladder conditions. Cancer was always way at the bottom. It was more or less a disease of old animals. And as you can see right now, cause of conditions in dogs, top of the list, cancer. Cause of disease-related deaths in dogs, cancer, 47%. That means almost 1 out of every 2. And also, you can see it in cats. Just as an example, this is a dog that his abdomen is full of lymph cancer, his chest is full of lymph cancer, and you could actually see the cancer process has actually eaten itself out of both cavities. This dog in this picture is 10 and a half months old. And as you can see here, private kitten, 13 months, 2 weeks old, at death. So there's something wrong in our society if cancer is becoming the #1 disease that we're treating right now as veterinarians.
Let's say that you have a cat, and your cat is susceptible to kidney disease, diabetes, ticks and fleas, feline leukemia, emotional problems, urinary tract infections. How do you deal with these? What are the causes? Can they be prevented? Let's talk with Dr. Michael Dim. Michael, nice to have you with us.
Good to be here, Gary.
Michael, what causes all these conditions in cats?
The 3 main reasons why we see these problems in cats are, number 1, the poor quality commercial foods that most of these animals are getting, mainly the dry kibble. That has to be the #1 culprit of many of these illnesses. Second biggest factor is over-vaccinating these animals over generations. Vaccines have been around about 30, 40 years, so we're seeing these diseases related to over-vaccinating them generation after generation, a worsening of these problems that you just mentioned. And the third factor would be just inbreeding, too much overbreeding of some of the pure breed animals.
Let's focus on vaccines. Which vaccines do you believe are overused or possibly shouldn't be used at all?
The only vaccine that is really medically necessary in the cat would be what's called feline panleukopenia, or feline parvovirus as it's known. That is the only vaccine that has been shown to actually maybe work in these cats and to stimulate lifelong immunity. And a series of 1 or 2 vaccines at 3 to 4 months of age probably is enough immunity for the lifetime of that animal. The unfortunate thing is that they're combined with other respiratory viruses that actually not only don't work, but sometimes actually lead to chronic respiratory disease themselves by injecting these modified live viral diseases into the animal. And so panleukopenia and rabies as required by law are the only 2 vaccines.
Which are the vaccines that you then would suggest people challenge?
The feline leukemia virus vaccine has not only tested for safety and efficacy, but it's actually been shown that cats over 1 year of age are able to actually resist the feline leukemia virus all on their own. So in essence, I would not vaccinate any cat over the age of 1 for feline leukemia virus. The other vaccines that are out there are, for example, there's one called feline infectious peritonitis virus, or FIP virus. Cornell University did some studies that actually showed that the cats that were vaccinated for that virus were actually more prone to the actual field virus, so you want to avoid that one. There's a new one coming out for Giardia, the intestinal parasite. You want to avoid that one. The problems with most of these vaccines in cats is that they're not tested over chronic periods of time. And that's the main problem, the repetition of these things, the combination of these things, bombarding the immune system year after year after year. And that's what leads to this immune destruction of all of these organs and all these chronic immune diseases we see in our pets.
Right over here, I have just a list of the potential side effects of just one of the vaccines given. It's called parvo vaccine. And the list is immune reactions following canine parvo vaccines. This was compiled by Gene Dodds. Fever, stiffness, sore joints, abdominal tenderness, collapse, clumping of red blood cells, jaundice, general hemorrhages, liver and kidney failure, bone marrow suppression, where the immune system comes from, seizures, bloat, stained teeth, hyperthyroidism, hypothyroidism. And then in another list, in another study of dogs and cats after vaccines, immune suppression, autoimmune disease, rheumatoid arthritis, hip dysplasia, food allergies, itchy skins, chronic kidney failure, liver disease.
The flea and tick collars have pesticides in them.
That's right.
Sometimes the cat owner never takes it off.
That's right.
That means the cat is being exposed 24 hours a day, every day of the week, to a pesticide.
Right. And what it does is it confuses the immune system, and the immune system sees these things as foreign, and so you get an overstimulation of the immune system, and then you get a destruction of organs like the pancreas, like the kidneys, and
that leads to the disease and the kidney failure.
That's right.
What are we doing wrong? Why do we have an epidemic of cancer, hip dysplasia, arthritis, diabetes, upper respiratory tract infections, viruses in our dogs? To answer these questions, I've invited one of America's leading holistic veterinarians, Dr. Robert Goldstein, to share his insights. Nice to have you.
Nice to be here, Gary.
What are causing these conditions?
I think there's a number of reasons. One would be genetics, a lot of inbreeding. We mass produce animals for sale. That'd be number one. Our diets are totally improper. They're all leftover wastes of the human food industry.
The commercial diets that are prepared now are actually formulated from diseased, rendered, or slaughterhouse remains that are then processed, and we're getting actually rejected meat byproducts in the food, whether it's bone meal that is derived from sick animals, cancer-ridden animals that are actually rejected for the human population, are then taken and prepared as a commercial diet. Now, a lot of these are then processed with high temperatures, and it destroys or denatures the nutrients that you need, that you're actually trying to give your pet. So with the nutrients then already sacrificed by the processing, and you're taking inferior quality nutrients and putting it in there, we find that we have disease that's actually being produced.
Evolution has not found a way to handle all the artificial chemicals going into the body of an animal.
May I interject something here so I don't forget it?
Yeah.
BHT, BHA, ethoxyquin. Remember, BHT, BHA, and ethoxyquin. And if you see that on the label, forget it. Because those are preservatives which actually get to the point where they affect the breeding ability and the genetics and the DNA of the animals so that more problems are created. Remember that. Those three preservatives are deadly, and don't give them to your animals at all. If you happen to see that on the label, just forget about it.
We have environmental pollutants. We have chemical flea collars and chemical flea products, powders, shampoos. All this added together can weaken the animal's immune system. When the immune system gets weakened, that's when cancer and other degenerative diseases can come to the surface.
So it really is, it's not as if there's cancer and hip dysplasia and arthritis and diabetes and kidney failure as individual and unique entities. It's certain common causes like pollution of their environment, adulteration of their diet, using toxic, dead, diseased, rendered animals that go back into animal feed. This is what's causing all these conditions.
Yes, the common denominator is the immune system. The immune system is being bombarded. They're genetically weakened to begin with. It gets bombarded, it gets weakened, and then a chronic degenerative disease, no matter what the disease is, will then show up.
So it's wherever the animal is most vulnerable is how the disease will manifest.
Yes, that's correct.
The basic problem with conventional medicine is that it sees the symptoms as the disease. Basically, the symptoms are just an expression of an inner imbalance of the body, and actually the body trying to fight off the disease. So when the doctors use the medicines such as antibiotics and steroids and antiemetics and antidiuretics, they're actually working against the body. We're actually not healing the body at all, but suppressing the symptoms and causing worse problems that can show up later on in life.
It might surprise you to realize we have almost 7 million horse owners in the United States. Question is, how long should a horse live? What should they eat? How could we take better care of them? Dr. Judith Shoemaker, what are the primary conditions that horses suffer from?
I think there are 5 basic categories of problems that we see. The most common is chronic repetitive lamenesses and injuries to feet and joints. The second one is muscular injuries, sports injuries, training problems, oftentimes balance problems, TMJ problems that interfere with the horse's performance. The third is probably immune-mediated disease, skin allergies, food allergies, chronic obstructive pulmonary disease, moon blindness. The fourth, I would say, would be hormonal dysfunction, emotional disturbances, again, causing training problems, breeding problems, and quite severe problems for the animals and their owners. And the fifth, catastrophic gastrointestinal disturbances, colic, and the diseases of old age, tumors, and other problems that we see in people.
How many of those conditions are preventable?
Most of them are preventable. They're much more easily prevented than they are treated. The chronic lamenesses are most of the time due to imbalance in shoeing, inappropriate management of exercise, and oddly enough, management of the teeth. So the way that the animal is trained, the way that his equipment fits, and how much he's turned out. Those all have incredible importance in management and avoiding chronic lameness. Sports injuries as well are a function of proper management. They are rarely just bad luck.
How is it that ferrets are not living as long as they should live? And what are the conditions that ferrets suffer from that you believe can be prevented?
Well, I think ferrets don't live as long for the same reason that dogs and cats don't live as long as they should, and that is because we feed them processed foods that are cooked and that really are very difficult to digest and also don't have the full spectrum of nutrition that they should. The owners should feed raw food, especially raw meat. And if you can't feed raw, then at least add supplements in terms of digestive enzymes. And that's very important that you also do give bacteria to the intestines, because we tend to give sterilized food when we buy foods from a pet store. And also that you give those, of course, phytonutrients. Now, they can't have phytonutrients in the form of a lot of vegetables and fruits. They love to eat them. They love sweet things. But you want to give those things without all the fiber. They can't have more than about 4% fiber. And so the juicing is a very good idea for ferrets, so that they get all those nutrients without the negative for them, which is the fiber.
What are the primary illnesses that ferrets will suffer from, and why?
Well, the things that I, as a veterinarian, come across a lot, besides obvious things like ear mites and other parasites, are hormonal imbalances, such as adrenal gland tumors, such as insulinomas. That's a little tiny tumor on the pancreas that causes them to seizure. And also an infectious disease called canine distemper. These are the common things that I'll see. But also, as an emergency, them being so curious and so willing to try out different things around the house, often have to take out foreign bodies from inside the intestines. So the cause of that is obvious. The cause of the canine distemper is a virus. But you asked also about these other things, the hormonal imbalances. Possible causes of the hormonal imbalances are the fact that ferrets nowadays are neutered so early. They're spayed or castrated at a very young age, only a couple weeks old. And this is by law now.
But that's because their hormones have not fully developed.
Right, and they haven't had a chance to establish the normal rhythms and balances in their body. So we have off-balanced them, I suppose.
Right.
So that's possibly a reason.
You can over-vaccinate them, too.
Vaccines probably are a very important cause, too. But why do some ferrets that are vaccinated and that have that are neutered early not have these problems? Probably nutrition is a very important part of everything, besides genetics.
Good.
And I think by giving them the proper nutrition, we'll at least remove that as a possible cause and maximize their chances of not having to see the veterinarian other than for routine visits.
I appreciate you being on and sharing these insights. Thank you.
It's a very pleasure.
I've invited Dr. Lori Hess, a veterinarian, to share her insights. Nice to have you with us.
Thank you.
Do you have any idea how many people own rabbits?
I would say a great number of people. I know in my practice rabbits are certainly one of the most common species that we see. They make fairly good apartment pets because they're small, they don't require a tremendous amount of space, and they're fairly easy to keep as a small pet in an apartment. So in New York City
How
we see a
long
lot.
do rabbits live?
It really depends on the breed of rabbit, the size. They can live into their teens if kept appropriately, and some do. Unfortunately, many don't because people don't, again, feed them or treat them right.
What are we doing wrong?
Again, diet is a big thing, and environment. We know one of the problems that we see in rabbits quite commonly is that they can get infections in their teeth or abscesses in their jaw, which require surgery to fix. And we're thinking now that sometimes the reason they get this problem is that they're not getting the appropriate diet. They need roughage in their diet, hay. They also get a lot of gastrointestinal problems, a lot of what we call hairballs or gastrointestinal stasis, which just means a slowing down of the gastrointestinal tract. And that's because they're not getting enough fiber. In the wild, rabbits chew on hay all day long, they graze. And many people are not really aware of that, and they don't provide hay to their rabbits. So you need to provide them with hay, some carbohydrate in the form of a rabbit pellet, and then some fresh greens every day also to help their gastrointestinal
There's
tract.
different types of hay. What type of hay?
Generally, we recommend for most rabbits that are adult rabbits, Timothy hay. It's a sort of browner hay than the average green hay that you see in the store, which is usually alfalfa hay. Alfalfa hay is fine in small amounts for growing rabbits, but it really has too much calcium in it for the average adult rabbits. They tend to form bladder stones and kidney stones from these high calcium hays, the alfalfa. So we try to avoid that.
So Timothy hay.
Timothy hay.
Good. What kind of bedding?
Well, we want to give them a bedding that they're not going to chew and have it get stuck inside. And we know things that are safe are paper towels. Everybody has paper towels in their home. It's cheap. It's totally digestible.
Good. Thank you.
You're welcome.
Seth, what are some of the most common problems and conditions that fish owners have to deal with?
The most common problem initially would be ick, an outbreak of white spots all over the fish. The other conditions are new tank syndrome for new hobbyists. We are setting up a tank and they don't let the tank properly mature, the filter properly mature. And I mean mature is that the bacteria must build up on the filter and then into the tank to help break down the waste of fish. So they had a lot of fish at once. They're not too patient. They want to see a lot of pretty fish swimming around the tank, and therefore they have problems.
Tap water needs to be conditioned all the time before you put it in your aquarium. There's liquid dechlorinators that you can get from a pet store. By adding it to the water, your tap water, it neutralizes the chlorine and thus makes it safe for your fish. Make sure that once a month you do a partial water change, 30% at the most, vacuuming out your gravel. By doing a 100% water change, you're eliminating a lot of the good bacteria that is actually stabilizing your environment.
There's a lot of alternatives to the real toxic flea products that have just come out now. Basically, we worry about the environment, we worry about the yard, and we worry about the fleas and ticks on the animal. The most important thing is that you want to build up the health of the animal. A healthy animal definitely attracts less fleas and ticks. And you'll see this in households where they have 6 or 7 animals. 1 or 2 of them will be loaded and the other ones won't have anything. One simple thing you could do is make a lemon rinse. You take a couple of lemons, you cut it up, pour boiling water over it, let it steep, then let it cool. Then you can sponge this on the animals or spray it on. One good essential oil that you could use on the dogs is you take a few drops of eucalyptus oil or pennyroyal, and you can add that to a little bit of water and spritz it on the dog, or you can add it to some cockatiel soap or some natural soap and give a shampoo. Leave it on for 5 minutes, and that will help to reduce the fleas and ticks that will attach to the animal. One important thing that I do for fleas, flea combing, mechanically removing the fleas. Fleas really spend about 20% of the time on the animal, and if you flea comb them every night, you are going to physically remove it and they will not be a problem. Then what you want to do is to put them in some hot soapy water and let them drown, or use some flea spray or something to kill them, but you basically can flea comb them and remove the fleas. In terms of the bedding, you can use some black walnut leaves in there or some cedar shavings, and basically that is a deterrent to the fleas. They're not happy in that environment. Something else you can do in the house are the boron products. You can buy them over the counter or through catalogs with flea busters or even 20 Mule Team Borax. You can buy that from your supermarket. What you do with that is that you sprinkle it around your floors and your furniture and on your carpeting, and you want to broom that or rub that into all the areas, let it sit overnight, and vacuum it up the next morning. That is 100% effective in getting rid of any fleas in your house. Another excellent product are actually microscopic worms or nematodes. They eat flea larvae. You have to get that through a catalog or some kind of pet supplier. And there are directions that come with this. You want to sprinkle it around your yard, and they actually ingest the flea larva. And you can do this once every 5 or 7 years. Once you get them going and eating the flea larva, they'll multiply year after year, and you don't have to do anything more.
Michael, what can we do if you have a cat that is sick to get it well? What are the therapies that make a difference?
Well, the first thing is that I would stop all unnecessary drug or toxic exposure, meaning no more application of any flea products, even though your veterinarian may say that they're very, very safe. Second thing I would do is do the homemade raw meat-based diets. Third thing I would do is add some antioxidants, bioflavonoids, to the cat's diet. Vitamin C, lycopene, proanthocyanidins, the essential oils, fish oils, flaxseed oil. All of these not only enhance the immune system function, but actually can help the animal fight off cancer.
N-acetylcysteine, quercetin,
right.
Selenium,
right.
Vitamin E.
Vitamin E, vitamin A. And like I said, I especially in my practice stress the proanthocyanidins.
Green tea.
Green tea is wonderful.
Mushroom complex.
Mushrooms, yeah. All of these things are general support measures for cancer. You can also use certain cancer-fighting and immune-boosting herbs. Things like ginseng and ginkgo and other herbs, dandelion, wonderful for the cat's immune system, wonderful to help get rid of the toxic buildup, and not only having cancer, but having also all these toxins building up in their system.
By the way, in nature, if a cat's really sick, you'll frequently see it fasting and eating grasses.
Right, right.
The green bitters.
That's terrific.
Isn't it interesting that instinctually they know that bitters are good as purgatives?
That's amazing. It really is. And I get the question all the time from my clients, why are they eating grass? Why are they eating my plants? Well, they're not getting the chlorophyll from the processed commercial foods. Fasting them periodically, very important for the cat. Cats should not have, food to nibble at. Even the homemade diets, don't leave it down for them to nibble throughout the whole day. Feed them once a day. And then you should fast them 1 day a week where they get nothing but fresh liquid, and make sure that the water is spring distilled or pure water, because we all know how intoxicated our water supply is with all sorts of parasites and chlorine and fluorine and giardia, those type of things.
I hope you've enjoyed, at least up to this point, what we've shared, but there's more to come. We'll continue with our program next week. I'll see you then.